Hello. In Part 3, we'll talk about treatment for gambling addiction. 12-step-based programs such as Gamblers Anonymous are specific to gambling and generic to healing addiction, creating financial health, and improving mental wellness. Commercial alternatives that are designed for clinical intervention, using the best of health science and applied education practices, have been used as patient-centered tools for intervention since 2007. They include measured efficacy and resulting recovery metrics. However, the effectiveness of 12-step programs alone is not as strongly supported by empirical evidence as other approaches. The scientific understanding of GA and other 12-step groups for gambling addiction is complicated by several factors. Variable effectiveness. A meta-review of gambling disorder treatments found moderate evidence of effect for cognitive behavioral therapy, CBT, but weaker evidence for self-help interventions like GA. This suggests that GA may not work for everyone and might not be as effective as psychotherapy for some individuals. Methodological challenges. Studies on GA's effectiveness are often hindered by high dropout rates, especially within the first 6 months, and a reliance on self-selected samples. This makes it difficult to draw scientifically rigorous conclusions. Co-occurring conditions. Gambling disorder often co-occurs with other psychiatric issues, such as substance use disorders or bipolar disorder. How these combined issues should be treated is not yet well understood or empirically studied. Inclusivity concerns. Some researchers have noted that new members may struggle to identify with others in GA meetings, which can lead to feelings of being left out and potentially contribute to higher dropout rates. Despite these limitations, GA can offer significant benefits, particularly for those who engage fully in the program. Peer support. GA provides a strong sense of community and connection with others who understand the struggles of gambling addiction. For some, this community connection can help to rewire the brain's reward pathways, creating healthier dopamine responses. Structured recovery plan. The 12-step model offers a clear, structured path to recovery through self-examination, accountability, and spiritual growth. Accessibility. GA meetings are often widely available and free, making them a highly accessible option for many people seeking help. Enhanced outcomes with combined treatment. Research has found improved outcomes for GA participants when the program is combined with other professional therapies, such as CBT or motivational interviewing. Motivational interviewing is one of the treatments of compulsive gambling. The motivational interviewer's basic goal is promoting readiness to change through thinking and resolving mixed feelings. Avoiding aggressive confrontation, argument, labeling, blaming, and direct persuasion, the interviewer supplies empathy and advice to compulsive gamblers who define their own goal. The focus is on promoting freedom of choice and encouraging confidence in the ability to change. Healthcare providers often recommend combining 12-step programs with professional treatment to increase the chances of a successful and lasting recovery. Professional guidance. A 2024 Medscape article noted that psychotherapy, including CBT and relapse prevention, probably works best for gambling disorder. Another article noted that specialized residential treatment programs can integrate the GA model into a more structured, intensive daily routine. Pharmacological options, medications, such as opioid antagonists, have shown some promise in reducing gambling-related symptoms, especially when combined with psychotherapy. In summary, 12-step programs are not a one-size-fits-all solution for gambling disorder and have less empirical support as a standalone treatment compared to professional therapies like CBT. However, they can be a powerful tool and provide valuable community support for those who fully commit to the program, particularly when used in conjunction with other clinical treatments. Self-help can be effective for gambling addiction, but its success varies by individual and depends on several factors. Here's a breakdown based on available evidence. Effectiveness of self-help approaches. Self-help workbooks and resources. Studies suggest self-help materials, like cognitive behavioral therapy, CBT-based workbooks, can reduce gambling behaviors and related harms. For example, a 2020 study found that self-help CBT workbooks led to significant reductions in gambling frequency and losses for some participants, though outcomes were better when combined with professional support, e.g., guided self-help with therapist contact. It was published in the BMJ Open Journal, and while it's primarily a protocol for a larger trial, it built on and analyzed preliminary data from related self-help CBT interventions, showing significant reductions in gambling frequency and financial losses, especially with guided elements. It was led by Andreas Nilsson, primary author, and a team of collaborators including Christina Magnusson, Per Karlbring, Gerhard Andersson, and Katarina H. Gumpert. The research was conducted through the Department of Clinical Neuroscience at Karolinska Institute in Stockholm, Sweden, with contributions from affiliated researchers at Uppsala University and Stockholm University. The study emphasized internet-based, workbook-style CBT modules with therapist support, and it's part of broader work on accessible self-help for behavioral addictions. Online self-help programs, digital tools, such as apps or websites offering exercises to manage urges, track spending, or set limits, show promise. A 2019 meta-analysis indicated that online self-help interventions can reduce gambling severity, especially for those with milder issues, though long-term adherence is a challenge. Self-exclusion programs. Voluntarily banning oneself from gambling venues or online platforms can be a practical self-help tool. Studies indicate self-exclusion reduces gambling behavior in the short term, but without addressing underlying psychological triggers, relapse is common. Limitations. Motivation and discipline. Self-help requires strong self-motivation and discipline, which can be difficult for individuals with severe addiction. Dropout rates in self-help programs are high, up to 70% in some studies. Severity of addiction. Self-help is often more effective for problem gambling, milder cases, than for severe gambling disorder, where professional intervention, e.g., therapy, medication, is typically needed. Lack of personalization. Self-help tools may not address co-occurring issues like depression, anxiety, or substance abuse, which are common in gambling addiction and often require tailored treatment. Key strategies in self-help. Cognitive restructuring. Identifying and challenging distorted thoughts, e.g., "I'm due for a win," can reduce gambling urges. Self-help workbooks often include exercises for this. Behavioral changes. Setting financial limits. Avoiding triggers, e.g., gambling venues, and replacing gambling with alternative activities are common self-help techniques. Mindfulness and stress management. Techniques like mindfulness meditation can help manage cravings and emotional triggers, with studies showing reduced gambling severity in mindfulness-based interventions. Peer support. Engaging with others via forums or groups like GA provides emotional support and practical tips, enhancing commitment to change. When it's most effective, self-help works best for those with high motivation, milder symptoms, or as a supplement to professional treatment. Combining self-help with periodic professional guidance, e.g., therapy sessions, increases success rates, as shown in randomized trials where guided self-help outperformed unguided approaches by 20 to 30% in reducing gambling severity. Challenges and risks. Without addressing deeper psychological or social issues, self-help may only provide temporary relief. For example, a 2021 study found that 40% of self-help users relapsed within a year without ongoing support. Over-reliance on self-help can delay seeking professional help, especially for severe cases where medical or psychological intervention is critical. Self-help can be a valuable starting point or complement to treatment for gambling addiction, particularly for those with milder issues or strong self-discipline. However, for severe cases or if progress stalls, combining self-help with professional therapy, e.g., CBT, motivational interviewing, or support groups like GA is more effective. If you or someone you know is struggling, resources like Gamblers Anonymous, gamblersanonymous.org, or online tools like Gambling Therapy, gamblingtherapy.org, can be a good start. For personalized advice, consulting a therapist specializing in addiction is ideal. While psychological therapies like cognitive behavioral therapy, CBT, remain the cornerstone of treatment, pharmacological options are often explored, particularly for individuals with co-occurring conditions such as depression, anxiety, or substance use disorders. Importantly, no medications are currently approved by the FDA or any major regulatory body specifically for treating GD. All uses are off-label, meaning they are prescribed based on emerging evidence from clinical trials rather than formal indications. Patients should discuss risks, benefits, and alternatives with a healthcare provider, as side effects, e.g., nausea, mood changes, can occur, and adherence rates in trials are often around 40%. Evidence from randomized controlled trials, RCTs, and meta-analysis suggests certain drugs may reduce urges, cravings, and gambling behaviors by targeting neurotransmitter systems like opioids, serotonin, glutamate, and dopamine. Opioid antagonists, in particular, show the most consistent promise due to GD's overlap with substance addictions. Below, I'll outline key examples, supported by trial data. Here's a summary of commonly studied drugs, grouped by class. Efficacy is typically measured by tools like the Yale-Brown Obsessive-Compulsive Scale Modified for Pathological Gambling, PGA-Box, or Self-Reported Gambling Frequency. These findings come from over 18 double-blind RCTs and recent meta-analyses, e.g., a 2024 NMA reviewing data up to February 2024 across databases like PubMed and Cochrane. Opioid antagonists like naltrexone and nalmefene stand out for broad applicability, but individual responses vary. Factors like genetics, comorbidities, and trial duration, often 8 to 16 weeks, influence outcomes. To illustrate, here are 3 notable trials highlighting pharmacological approaches. Naltrexone RCT, Kimitol, 2001, replicated in later studies in an 11-week double-blind, placebo-controlled trial with 45 adults with GD. Participants received naltrexone, mean dose 188 mg per day, or placebo. Results showed significant reductions in gambling thoughts, urges, and behaviors measured by PGA-Box, with 75% of the naltrexone group classified as responders versus 24% in placebo. This trial underscored naltrexone's role in modulating the mesolimbic dopamine pathway, similar to its use in alcohol dependence. Nalmefene RCT, Grantitol, 2006, a 16-week double-blind trial, N equals 52, tested flexible-dose nalmefene up to 100 mg per day against placebo in treatment-seeking GD patients. Nalmefene led to greater improvements in gambling severity and CGI scores, with benefits persisting post-treatment. A follow-up meta-analysis confirmed its edge in reducing relapse risk. Topiramate RCT, Burgetol, 2013, updated in 2024 NMA, an 8-week open-label phase followed by a 6-week double-blind extension, N equals 27, found topiramate reduced PGA-Box scores by 50% in responders. The 2024 NMA, analyzing 19 RCTs up to 2024, ranked it highly for tolerability, suggesting potential for those with co-occurring impulse control issues. Ongoing research, e.g., trials registered on clinicaltrials.gov as of 2024 to 2025, explores novel agents like ketamine for comorbid depression and psilocybin for craving reduction, but results are preliminary. A 2024 systematic review emphasizes the need for larger, longer-term studies to personalize treatments. In summary, while pharmaceutical options exist and show moderate efficacy in trials, they work best alongside therapy and support groups like Gamblers Anonymous. If you're seeking treatment, consult a specialist. Resources like the National Problem Gambling Helpline 1-800-522-4700 in the US can help. The last part is finished. Thank you kindly for your attention.